All right, we'll just start with some introductions of our Midwest Tribal ECHO team first. Dr. Robbie?
Hi, my name is Kari Robbie. I've been here at NACC for 13 years. I'm a family practice and addiction medicine physician. Thank you for joining us.
Good, and Nikki?
My name is Nikki Jardina. I'm the syndemic nursing supervisor at NACC, and I've been here for about 8 years.
Good, and I'm Lindsay Kincooney. I'm the harm reduction supervisor at NACC. I've been here a little over 3 years and also helped to facilitate this ECHO program. So with that, I'm going to share my screen. We'll just start with some announcements. All right, so welcome again, everybody. This is the Midwest Tribal ECHO Opioid Use Disorder Education and Treatment Series. Today, we are excited to welcome Lucy from Indigenous Peoples Task Force, who will be talking about youth empowerment, harm reduction, and housing today. A little bit about NACC, if you're not familiar, we are an FQHC. We were established in 2003. We're located in the urban Indigenous community in South Minneapolis. Our website is listed down at the bottom, so feel free to visit us. The list there is just a list of all of our services that we provide. These are current open positions at NACC. I'm just going to read through them because usually we have more, but we have the chemical healthcare coordinator position, peer recovery specialist, behavioral health provider, chemical healthcare counselor, registered dietitian, medical lab tech, and quality manager. So all of those.
Can I add one to that?
Yeah.
And we actually just posted I think it's called a clinical project manager who would help to manage the development of our mobile health and maternal child health programs in the clinic. So that I think was just posted moments ago. If anybody is interested, please apply.
Amazing, thank you. So the website again is there at the bottom. So feel free if you go to our website and go to the job sections, you can read more. Just some session guidelines, so no protected health information during the session. Love to see faces, so if you're able to turn your camera on and willing, that would be great. And then if you could let me know who you are in the chat so that I know who to send out information and slides to, that would be great. And then feel free to ask questions. You can put them in the chat. We can keep an eye on that, and then we'll have time at the end for discussion. This is a list of other ECHOs that we recommend that offer information on similar topics. And if you would like more information on these, just feel free to reach out to me and I can get you connected. Just some announcements. So we do meet, Midwest Tribal ECHO meets the first and third Wednesday of every month from noon to 1 p.m. Our next session will be in 2 weeks on November 19th. And that will be with actually Simone, our director of our intensive outpatient treatment center, and then Hennepin County Healthcare. We'll be talking about their partnership with peer recovery services in the jail system. And then finally, case presentations. If you have anything to share, they make for great discussion. Definitely, we haven't had one of those in a long time. So welcome any suggestions or examples that you have to offer. My email address is on this slide, so feel free to reach out. And then I think that's it for me. So I'm going to stop sharing and I will hand it over to our speaker today. Lucy, welcome. Thank you for being here.
Hello, thank you for having me. Everybody. Hello, everyone. My name is Lucy. Like mentioned earlier, I'm a peer recovery specialist and a housing stability case manager at Indigenous Peoples Task Force. And so I'm just here to talk to you guys about how I kind of got into my role and the work that I'm doing now and how my experience has really navigated me to doing the job in the community. So I'm going to go ahead and share. And then can you guys see that just fine? Okay. So today I'll be talking to you guys about youth empowerment, harm reduction, and housing. So within youth empowerment, I'll talk a little bit about A Kid to Win and Keep the Fire Alive, which are two youth programs that really developed my sense of community within Indigenous Peoples Task Force and just Southside. And then the Call Your Spirit campaign that I worked on last year. We'll get into harm reduction, my recovery story, and then how I became a certified peer recovery specialist. And same thing with housing, with my lived experience in housing navigation. Okay, so little Lucy here. I started off working with Indigenous Peoples Task Force as a youth. I was around 11 years old when I started in their A Kid to Win youth programming, which was education and HIV and STD prevention. We educated a lot of our peers who are our age in regards to.
Sorry to interrupt, Lucy. I just wanted to say the presentation, it's not in presentation mode. We're
Oh,
just
okay.
not seeing the
Okay.
slides.
Oh, I see. Okay, 1 second. Can you see it now?
Yep.
Yeah, that's
so
great. Thank
Okay,
you.
okay, awesome,
Thank you.
awesome. Okay, so go back to the slide a little bit. Again, A Kid to Win was just for us to be able to educate our peers, people our age, that were in the same age group as us, to be able to talk about HIV and STD and STI prevention. This is kind of where my public speaking propaganda kind of started, with being the lead in one of our plays that we did on one of our ensembles. And then again, just educating other youth in regards to the prevention that Indigenous Peoples Task Force has really been working on since the late 80s. Then I grew up in foster care, so I kind of grew up all over the place a little bit. And I returned to Indigenous Peoples Task Force through one of the peers that I was actually with in A Kid to Win. And I became certified, which I'll talk here about in a little bit. Through the internship, though, I did gain like leadership skills, learned about community healing, networking, and collaboration. And that really played a big, big role in supporting the campaign that I worked on through my internship, which is the Call Your Spirit Back campaign. We partnered with Hennepin County Opioid Response Initiative, partnered with IPTF to create these bus shelter posters to engage with our relatives about calling their spirit back. And I'll get into a little bit about what that is, but first I'll just go over like logistics quick. It was led by IPTF's coordinators, our managers through the internship. I was a part of a team of 16 who collaborated to create different sketches. We identified different target audiences, found different themes that we found, such as people who had any type of addiction disorder, as well as like people who identified as Indigenous. The sketches were then sent to a graphic designer, an Indigenous graphic designer named Beth LaPence, who then was later published by Metro Transit. This project really, really played a huge role in my role and my experience here at IPTF, with the amount of calls that we got through this campaign in order for us to be able to connect relatives to the support that they're needing, whether it was housing, harm reduction resources, treatment, detox, even as simple as something as food. So this campaign played a really big role in the youth engagement when it comes to the youth empowerment within the community. And I'm very proud of like the work that not only my cohort did, but as well as like the following cohorts that they're doing to keep this campaign active and ensure that our relatives are again receiving the support that they need in a timely manner, and as well as a poster that's able to call to them in a way that is creative, in a way that is person-centered, in a way that is compassionate and caring, and in a way that it really like accepts all of our relatives into our community. So that was the Color Spirit Back campaign. Harm reduction. So I was in active use for a little over 8 months, and my active use was not, my addiction was not to any opiates, it was to stimulants. And I had a couple of trials or relapse before I fully got clean in January of 22. I then relapsed a year later after me being fully clean and in my recovery journey. And that one relapse really helped me engage with, helped me really engage with understanding as far as like why I probably don't want to go back to that type of environment, what I want to stay away from. And it also kind of led me to my journey of being a certified peer recovery specialist, as well as having experience with dealing with my mom who was in active use for over 15 plus years, and my brother who is currently in active use. So I got certified through the internship. I got certified this year in April. One of the things that really leads me in the work that I do here at Indigenous Peoples Task Force is the main factor of culture is prevention. I'm a really firm believer in that. I stand by it 10 toes. I think that the more that we implement our culture into the recovery journey of our people's lives and our community lives, I definitely think that we can see some great progress. I've done a lot of different things as far as culture prevention. Again, in the work I do here by giving out medicine bags, we also have out a sacred fire that we do at our community meal every Wednesday, starting at 1, where our relatives are able to come and pray. Sometimes, and a lot of times, they don't want to smudge, they don't want to pray, they don't want to engage with anything that's very cultural. And so instead of just saying like, okay, and like kind of walking away from it, and I have a better understanding that these medicines are something that was provided to us from our creator, and really implementing that structure into, again, the work that we do here by asking them, am I able to smudge you down? Like, even if you don't want to do it yourself, can I do it? Can I pray for you? Can I walk with you through this process of trying to navigate how you want to, call your spirit back naturally and culturally? And then as well as, I'm very big on youth empowerment. I believe in supporting the youth. Our executive director, Sharon Day, talks about it all the time. It starts with the youth. And I never fully understood what that meant until I really looked back and realized that when it started with the youth, I was that youth at 11 years old who was experiencing a lot of trauma, who was going through a system that did not benefit her. And then when I turned 18 and got into my active use, I understand that I could have went down a completely wrong path. But understanding that it starts with the youth to change that dynamic and really understand how we can prevent our youth from becoming the relatives that we serve now, I think is a very clear way of, again, to empower our youth, empower the leaders of our community to lead our youth into the right paths and to the way of our traditions and our way of life. When it comes to community engagement, I've navigated my biological mother into recovery. Again, she was in active use for over 15 plus years. So that was one of my pretty great accomplishments this last year, as well as supporting my brother now through his currently active use. And I just like to say too, for those of us who have family members who have been like impacted by the opioid use pandemic or any type of drug epidemic at all, I always try to spread the message of love. And as much as we always say harm reduction, we meet people where they're at. I think it really takes meeting people where they're at. I have an understanding that if I'm not loving my brother in the way that I'm loving my brother right now, there's nobody else that's going to do it for him. So when he's lonely, when he feels like he needs to use to cope or, do anything, sometimes instead of using, he calls me and he calls me crying. And sometimes he'll call me upset or something like that. And we just have a really long conversation. And it makes me proud to say when I get off of that phone, at least he didn't use, at least he kind of took a step back and made a phone call, and so to have that support system just actively there and so accessible is another reason why I just promote the love and compassion that we not only share between like our relatives and the people that we serve, but our community. At the end of the day, we are human beings, which kind of goes into my next point, which is another intern and I, for those of you who know who Devon Trey is, or Trey, he's an intern here at Indigenous Peoples Task Force as well. And we created a series of events that we're going to do that are in relation to supporting our relatives as like a human being interaction, instead of coming as a 9 to 5, as like a peer recovery specialist, as a case manager, just as another human being who understands that sometimes people just want to have fun, relax, have something else to think about other than, again, going to treatment resources and things that I could and should use, or things that probably aren't good for me. So it's like finding that like median in the middle to be able to support our relatives in the way that's going to make them more cohesive and building rapport that actually fully matters, versus just, again, sitting in front of them with the idea that someone can help them and could help them along their way of recovery, versus just being a friend. I have also created partnerships with ICWA to be able to become peer supports for some of the parents that are going through losing their children, or at risk of losing their children, their housing, different barriers they may be facing. So we definitely created a partnership with the ICWA, the Juvenile Justice Center within the ICWA department there, working with the gals to ensure, again, that they're kind of meeting the needs with the parents to ensure that they can create stability to be able to get their children back. And then I just recently created another partnership with the Hennepin County Juvenile Probation Officer Department to be able to, again, work with youth between the ages of 18 and 24 to ensure that we're kind of lowering our rates when it comes to the crime rate, the amount of people that, again, are going through different traumas, domestic violence, drug use, and I think a lot of things we already all know. And so those are a lot of the community engagement things that I do off and on the hours of working at IPTF. And I will say that I love the support that I get from my team. They're all great helpers, and they all support, Trey and I in the work that we do with hosting these events. And we'll definitely be looking forward to doing another event soon. In regards to housing, so I have both lived experience of being unsheltered as a child with a family of 8, and as well as being unsheltered as an adult, both for 2 years. And both were in inhabitable environments. So as a child, I slept outside with my mom. I slept in the car, bounce around from people's houses from time to time, but mainly outside. And then as an adult, I kind of went through the same thing where I experienced homelessness outside in my car. There are times where I would try to get a hotel, afford the things that were going to make me sustainable. I was also not in active use during the time that I was unsheltered. I was working as hard as possible to ensure that I can find stable housing. That process, and I think that this is a conversation that needs to be have more clarity and have more understanding across the board, is that the system is so complex, right? I worked 2 years full time, and because of the barriers that I was facing, whether it was credit, whether it was not having, the funds to be able to afford, my housing, as well as not knowing any of the resources, because no resources are going to get promoted. So, the system was very complex in the way that it worked. I applied to numerous different places until I ran into a resource called Hope for Youth, who then was able to help me get into my first place, which did not end up working out. So I did have to kind of rework a lot of the things that I already worked so hard for, and kind of change my dynamic a little bit about the way that I would keep my housing, and as well as like the lack of education that I got for keeping my housing. There was no type of financial literacy course that I took, no budgeting system that I made for myself, and nor did I have the support system to kind of help me along that journey. And doing the work that I'm doing now, especially working in housing, I can say that there's a lack of education within how the system works. A lot of our relatives aren't understanding the complexity of it all and why it's so complex. And one thing that I always try to tell, my relatives as they're coming to me for the services that they're asking for, one, hard work pays off, and the journey can be unforeseeable. And I always will be realistic. I'm big on realism. And if we set these high expectations of what their journey could look like, I feel like we're only disappointing their expectation even further, which can create a lot of times like a re-trigger of different emotions and different trauma that they don't want to engage with, and they kind of will just run away from, instead of kind of following through with the plan and stick with it to ensure that they find stability. And so having that understanding has been able to guide certain principles to navigating housing opportunities for the relatives that I serve, and ensuring that whatever path and journey that they're deciding and wanting to take, that it is successful for them. And then again, just being realistic about the housing process to ensure the stability of our relatives. I think that's just one of like the most important things about housing when it comes to getting somebody from unsheltered to being stably housed, especially like if there's no transitional, process in between, and it's just straight from streets to housing. It can again be a very complex system that I want to ensure that our relatives are fully comprehending. One of the things that I'm currently planning, IPTF does informational tenant sessions, and the next one I do plan to have a panel for the coordinated entry system, so that way our relatives are able to come in and ask questions to priority list managers, to different housing programs, rapid rehousing, transitional housing, et cetera, and be able to like fully understand and have that information be relayed in a way that is understandable and that's not complex, that's not something that they're going to kind of fear away from. And so again, just kind of having all of these implementations of my experience of working as an emergency services navigator for a year, and then as well as like my own lived experience with being homeless. I can say that for myself, when I was homeless, having a housing worker who has no idea what it's like to be in the position that I was in was very hard for me, because a lot of times I felt like they did not understand where I was coming from. So I believe that having a navigator or someone who has that lived experience has definitely helped, our relatives feel more comfortable, more safe, and more secure in the housing process and the housing journey that they're looking for and looking after. So, and then that is it. That's my presentation.
Oh, miigwech, Lucy, thank you so much. Just want to open it up to the audience if you have any comments or questions about the presentation. I just want to thank you for being open to sharing your journey, and just you're doing an amazing job, and just thank you for what you're giving back to your relatives. And yeah, just a pleasure to collaborate with you. I know our teams collaborate a lot with outreach and housing services. And I love the idea of creating a panel to make, the housing resources more user-friendly to, I don't know how I myself have a hard time wrapping my head around it. So it's like we could use all the help that we can get from people like you. And so just thank you for what you're doing for the community.
Yeah, and thank you for having me. Honestly, being able to share that my story like now has definitely it has its worth. I for a long time I think I really sat there and was like, why am I going through this? Why am I going through this? Like, especially as a child. And then I guess coming around, I just turned 24, so coming around to experiencing another year around the sun has given me some enlightenment on like why I went through what I went through, and the journey and the path that Creator does like anticipate me to be on. And I'm very, very lucky to have a job where I serve such an amazing community that I love, and that I hope continues to just heal throughout generations. And yeah, and again, if we're sitting here and we're like, hey, like the housing journey is a little complex, imagine what our relatives who hardly know life skills are thinking about, hardly know, some of them don't have their high school diploma or their GED. So then imagine they're not having that support system, so they're not going to have a support system again when it comes into that. So yeah, again, thank you guys for letting me come and speak today.
System is really not made for the people trying to navigate it. It's made for the system. I think that's always so clear, and sort of have that layer of people who are able to be sort of doulas of the system, or just to help with the system is really helpful. I really liked, one of the things you said, just your, when you were talking about, love for our relatives and how to approach it. Like here at the clinic, like we talk about the unconditional positive regard, like everybody, we look everybody as having the, as we look at everybody positively, and that makes such a big difference in just how we approach everything with patients. So I really appreciated that. And I'm also very much aware that there's a very different way. It's kind of a different thing for us as a clinic, how we approach patients and how it is for family. Because I think with, like and you sort of, I feel like like how do you continue to show love for your family while showing boundaries, and like that is a piece that I'm always interested to learn more about, especially through the lens of harm reduction. Like how do you navigate that? And that I think is a tricky thing that a lot of our relatives have to navigate.
Mhm. And I can definitely say, like, specifically just speaking on family, I think what did it for me is that I begged my mom for 15 years to get clean. Like, I've done some ridiculous and embarrassing things to try to get her to where I wanted her to be at. And it took me finally realizing, like, she can only get there by herself. And she got there by herself for me to say, you know what, like, as much as I wanted all, like, I've never had a good relationship with my mom. So for the relationship to turn out after she got into sobriety, like, we still don't have a relationship to this day. And it did make me sit back and think about, again, like, if she's not even supporting me, she did get my brother, into active use at a very young age. He started when he was 15. And she's, in recovery, and she's sober, and she's, stably, well. And I think that that's great. But her son is still out here, and he's unstable, and he's in active use. And he was like my child. He was like my firstborn. I took care of all my siblings growing up. Said I grew up in the foster care system, and then eventually we were all separated. So for a while, I blamed myself about, like, I could have done more, I could have done something better, but I also had to recognize too that that wasn't my job. Like, I'm not the mom. Then it comes to the point where he did break boundaries. He did break certain limitations and expectations and standards that I had set in place, and we didn't talk for a while. And then it took him coming around and taking responsibility that made me kind of open up a little bit more, as well as a young guy that I worked with that reminded me of my brother. And I sat there and I'm like, as much as I work with this individual and as much as I give care to this individual, I should be able to do the same thing with my brother, someone who doesn't have that support system, someone who has nothing to rely back on. And I know that because it's the same thing for me. When I'm going through things, and when I'm struggling a little bit, or, when I've gone through some things recently where I could have used, like, a parental emotional support system, and I didn't have that, and I was lucky enough to say, and combat those things by myself. But to have someone who's so young and, like, trying to navigate life at that young age, and who's been doing so, it's just such a hard structure to, like, implement for them. So for me, the best thing that I can do is, like, lead myself by example. I have to, because he asked me one day, and my brother, he said, how did you do it? Like, how did you just stop? And I said, for me, like, I just one day woke up and I was done. Like, that was it for me. And I was like, but for you, it's not going to be that easy because of the withdrawals that come with it as well. And that experience taught me a lot as well about patience with these individuals that we work with. I understand now what they're running away from. That, that that feeling, like, there's not, like, especially a loved one, there's nothing that you could do to take that feeling away. There's nothing that you could do to comfort them. There's nothing that you could do to support them, to help them, to make them feel better. The only thing that you can do is sit there and love them. And by feeling that, again, like, he's still, like, in active use, but I can say that he's made his way to being more functional. It used to be like he just was outside all the time, all day, every day. And now he works a full-time job. Now he's going back to school to get his GED while still in active use. And that's based off of just the support system. Eventually, when he's ready to face that sickness head on, he knows that I'm going to be right there. But again, I feel like it definitely deals with, like, building that rapport system, building that support system, and ensuring that, specifically, like, with family members, like, I'm not going nowhere. And I feel like a lot of our community, and, like, specifically, like, within the Indigenous community, we always run away from the part that scares us the most. because we don't want to run into somebody, you know, one of our loved ones ODing and then us having to deal with that. But for myself, and excuse my French, but I'll be damned if I don't talk to my brother and he's gone tomorrow. I can't do that. That's already hurtful enough for itself. I'd rather be a support system knowing that I did everything that I could to ensure that he was mentally and emotionally okay before anything else. And I think that's again like the part that just like really leads me into supporting him the best way that I can.
I think that for, as providers, I think providers struggle with, having patients that there's a feeling like patients are lying to them or dishonest to them, and I hear family members talking about how like they like somebody in active use will like take take something from their family, like whether it's the Nintendo for the kids or something to sell, and I think that can be a hard thing to navigate. That is not a personal thing, that's the addiction, not that sort of like separate the parts of the, the addictive part of the person and then there's the person. And like, I imagine that would be also a very hard thing to navigate.
Yeah, no, for sure. And I feel like they're on both ends, like on the relative side, on the family side, on the professional side, there's responsibility that needs to be taken on all parts. But again, it's like, how do we lead that? Because again, like our relatives barely know life skills, they barely know how to like fully take care of themselves. So they're not thinking about the more complex options, the more complex things, the relationships, the
Right.
relationship building part, So the being honest part, I think, is like where like why I'm so heavy on again just building like those smaller relationships with like our relatives, like even if it's a simple like, hey, how are you doing, an event session, like, hey, at least you vented to somebody, even if it's not the truth, it's your truth and I'm not gonna judge you for it.
No.
And then like when it comes to more so like the provider end, I think that it's really like it relies on us like outreach workers, boots on the ground workers to, and I know we get so busy and wrapped up with everything else that we got going on. It gets really busy here at IPTF, but it takes like walking into that appointment with them to ensure that they're getting the care that they need. I've had a couple relatives who have come back and shared like poor experiences about the care that they've gotten there from their providers. It's like, okay, like how do we fix that? How can we ensure like, so it takes a sit down conversation with these providers, like with all three of us in the room having a conversation. How can we ensure that this individual that you're serving is going to get the proper care that they deserve? There's already been such a huge mistrust between Indigenous people and doctors since the beginning. And it's how do we, that those uncomfortable questions, it's like, how do we start breaking those cycles? How do we start? And it takes asking those uncomfortable questions, having those uncomfortable conversations to be able to make some type of change within that system. I'm very big on controversy sometimes, like when it allows. And those are just one of those things where I think it could be controversial, but I think it could also benefit us some good to, again, have those uncomfortable conversations to get some type of point across, right? So
that's where we learn. That's a lot of times those uncomfortable moments can be where we learn. So I completely agree. Thank you.
Thank you. And I don't know, Lucy, if you can see the chat, but a lot of gratitude to you and for sharing your story and the work.
Oh yeah, thank you guys. I did not see the chat. Thank you, thank you, thank you.
Does anyone have any other comments or questions? I was wondering if you have like a schedule of some of the activities that you're offering for youth, or some of the, when you talked earlier on, I'm trying to remember.
Yeah, so like if you're meaning like the side events that we host,
Yeah.
Yeah. So like we have yet to plan the next one out because like we went to the Wider Summit and then we're traveling so much, especially with the Call Your Spirit Back campaign. It's definitely like it's up on the reses now, like it's up on the reservations now where people can call and get connected to resources. We connect them to care like on the reservations. So I think that's pretty cool. So we were really busy with that. So we haven't yet planned, but I do want to say that should be around the same weekend as Thanksgiving weekend. Just because again, like the whole point is to ensure, like I know I don't have a support system and Thanksgiving gets lonely for me. So I can't imagine like what that experience is like for them out there, you know? So the last one we did was at Cedar Field and was like a field day. We tried to do a water balloon fight, but it was just a little too cold. So we just kind of stuck to doing like some field games. We had lacrosse sticks, we had food, and people just really seemed to enjoy themselves. And it made me so happy to like see something again other than normally like just what they're used to. Like they're used to being outside, they're used to bumping their music and chilling underneath the bridge, whatever. But if like see some games, some water balloons, like I feel like that again brings like a different joy than the joy that they're used to seeing. Like we got to show them something different, and I definitely stand on that 100%. So
Awesome. Well, yeah, we'll definitely keep an eye out for what's to come. But yeah, thank you so much. No one has any other comments. I think we can end a little bit early, but yeah, thanks everyone for being here. Lucy, is it okay if I send out your contact information if anyone has any follow-up questions?
yeah, absolutely.
Okay, great. All right, well, miigwech.
Miigwech.
Next session will be in 2 weeks on the 19th of November at noon. So hope to see you all there. Have a great rest of your day, everybody. Thank you.
Thank you.
See you guys.
Thank you.